Hi, I'm Anna. I'm a mum to 3 boys, aged 10, 6 and 4, and I'm an IBCLC, which is an International Board Certified Lactation Consultant. So lactation consultants, what we do is we offer specialist support to breastfeeding or chest feeding parents and to expectant parents as well. I'd like to say happy World Breastfeeding Week to you all, and thank you to my expert midwife for inviting me along today to answer some common questions that they get about breastfeeding. So one of the first ones we have here is, where are the best places to go and find out information on breastfeeding before giving birth? So breastfeeding preparation before your baby arrives is a great idea. There are lots of wonderful organisations that offer information and support, such as La Leche League and the Association of Breastfeeding Mothers. Some also offer virtual group breastfeeding sessions, and many lactation consultants in private practice are also offering virtual breastfeeding prep sessions and breastfeeding classes at the moment if you'd rather not do a group class. I also love several books out there that are wonderful for expectant parents. Some of my favourite are The Womanly Art of Breastfeeding by La Leche League, Breastfeeding Made Simple by Nancy Moorbacher, and a really cute, funny, entertaining and engaging one is The Food of Love by Kate Evans. Lots of parents really love that one. So our next question is, how long can colostrum be frozen for? And do I take the stash with me when I go to hospital to birth my baby? So how long your milk can be frozen for depends on your freezer. If your freezer has a variable temperature around -18 degrees Celsius, it is best to be used within 3 months, but it should be fine for up to 6 months. If your freezer has a constant temperature of 18 degrees Celsius or below, then your milk will be absolutely great to use within 6 months. It's best to be used within 6 months, but again, should be okay for this time up to 12 months. All that being said, there is no need to have a stash of colostrum to take to the hospital unless there are particular circumstances that mean you may need it, and your midwife can discuss these with you. However, learning to hand express before your baby is born is great. Hand expressing is a skill, and learning when pregnant means, should you need to hand express, you already know how. Learning a new skill when you are uncomfortably engorged, for example, or when your baby is crying because they're struggling to latch and because you're engorged and you need to hand express off some milk first, this is not an ideal situation. So already having the skill and knowing how to hand express first is great. So you can start to hand express in your 3rd trimester with the support of your midwife. And the next question that we have here are, what are your top tips for breastfeeding? Okay, yeah, plenty of those. So breastfeeding is normal and natural, but it may take you and your baby some time to learn. Top tips are to breastfeed early and to breastfeed often. When your baby is born, lay them skin to skin on you as soon as you can to make the most of their inborn instincts to breastfeed. Ideally, do this within the first hour after birth before any interruptions such as washing and weighing. Newborn babies need to feed at least 8 to 12 times in 24 hours. So here we're getting to the bit about breastfeed often. If you follow your baby's lead and feed when they offer you hunger cues, this is great. It is best to feed your baby when they show early signs of hunger. Like, these can be very subtle. They can be like eyes moving underneath closed eyelids. As soon as they're stirring awake, they start sticking out their little tongue. Contrary to popular belief, crying is a late sign of hunger, and your baby will then need to be soothed. And often when we soothe our babies, they fall asleep because they're tired out from crying and they end up missing a feed, and we can just get into a bit of a vicious cycle with this. Another tip that I love to share is to try laid back breastfeeding. So laid back positions ensure full body contact between you and your baby. Like laid back breastfeeding, it's about using positions that tap into your baby's natural reflexes. It's sometimes called biological nurturing. So your baby was born with the ability to move towards their food source, your breasts, and you can tap into this by reclining back, into this instinct by reclining back and placing them tummy down on your front. Being in this position helps you both because breastfeeding is now more about your baby leading the feed. It also helps to draw your baby's tongue out, and once they're latched, gravity helps them maintain a really good deep latch. So to do this, you can lie back on a comfy sofa or semi-reclined in your bed and propped up with loads of pillows and cushions. You want to make sure you're really well supported. If you want the whole of your back, shoulders and neck supported here. And when you're comfortable, place your baby on their front on your body. It's particularly important that your baby's thighs and the tops and soles of their feet are in contact with either you or whatever you're lying on. And this allows them to adjust their position. And sometimes parents find they bring their knees up when they're in this position. That helps their baby get some traction, be pushing with the soles of their feet against their knees. And although it may be easiest to start with your baby feet down on you, you can place them at any angle. Whatever works best here for you is fine. There are as many positions around the breast, it's like a dial of the clock, figure it that way. So as long as your baby has support on you or on your bedclothes, pillows, the cushions, that's fine. And also by doing this skin to skin, you can really increase the beneficial effect here. Moving on to the next question then. So we have, how do I know if I have mastitis? Well, here's hoping you don't, first off, and I will talk as well about how to avoid mastitis because it's incredibly uncomfortable and can make you feel really poorly. So to figure out if you have mastitis, the first thing to do is to start with a breast exam. So stand topless in front of a mirror and feel and look all over your breasts. You're looking for a tender, warm or red area, and you may also feel a lump. It may not be all of these things, it may just be one. And this lump and what you're feeling is caused by a blocked milk duct. And so addressing this quickly, if it's just a blocked duct at this point, can really help it becoming mastitis. Signs of mastitis are a fever, chills, like real flu-like symptoms alongside this painful inflammation within your breast. So if you experience any of these symptoms, you really need to act quickly to get the milk moving again by either feeding or pumping. And what we find best to help shift a blocked duct is to apply moist heat before feeding, exploring more than one feeding position, and really ensuring that your baby is well latched. And then after feed, you apply a cold compress, your standard bag of frozen peas in a towel. And applying that after feeding really helps reduce inflammation, and it's soothing. Therapeutic breast massage before feeding is also very, very helpful. So basically, to tackle blocked ducts and prevent them becoming mastitis, we're talking about wet heat, massage, feeding or pumping, and then cold compress. If you do have symptoms of mastitis, so then just remind you that's fever, chills, feeling flu-like, what you need to do, if you have these for over 24 hours, it's recommended to contact your GP as you may need antibiotics, but you still need to shift that blocked duct. But as I was saying earlier, avoiding blocked ducts and mastitis is better. And this can be done by making sure your baby is feeding efficiently and frequently, and that you're not allowing your breasts to become overly full. So how do you know if your milk supply has reduced? I'm going to combine this one with another question that I've seen come up as well, as they pretty much have the same answer. So the other question I get asked really frequently is, how do I know if my baby is getting enough milk? Some parenting books recommend routines for breastfed babies, but routines can reduce breast milk production, as can unnecessary supplements or dummy use or soother use while your milk supply is still establishing. So whatever the weight, a young baby needs to breastfeed at least 8 to 12 times in 24 hours. This is both to make sure they're getting enough milk and to establish their parents' milk supply. Frequent feeding is normal. Your baby's tummy is tiny and breast milk is quickly digested, so they do need frequent feeds to help them grow. Newborns, they often lose up to 7% of their birth weight in the first few days, and once your milk production increases, which usually happens around day 3 or 4, you can expect your baby to begin to regain that lost weight. Most babies regain their birth weight by 10 to 14 days old, and your midwife will be keeping a really close eye on this with you. So your baby will grow at their own rate, and a growth chart, which you will get from your midwife, will indicate how they're doing. Your breastfed babies gain approximately 150 to 225 grams per week. So that's a good sign that they're getting enough milk if they're hitting that. Another good indicator of whether your baby is getting enough milk is their nappies. Dirty nappies are a great indicator. What's going in is coming out. So from the 4th day, your baby should do at least 2 soft yellow stools around the size of, a £2 coin here in the UK. And they should have these every day for the first few weeks. Then also from day 5 onwards, wet nappies should become more frequent. We should see at least 6 heavy wet nappies every 24 hours. In the first 48 hours, your baby is likely to only have 2 or 3. So this is why we say from day 5 on. And also, your baby should appear healthy and alert when they're awake. Okay. Is it possible to restart breastfeeding after having a break? Okay, yes, this is actually a question that's come up quite a bit during this pandemic. Within my private practice, I've had a few parents contacted me worried because for whatever reason they had stopped breastfeeding, and given the current situation, they wanted to make sure that their baby was receiving the immunological benefits of breastfeeding, such as the antibodies that parents make and pass into their breast milk, and also the other immune factors within breast milk. So the good news is that relactation is possible. Relactation is the term we give to restarting breastfeeding after a break. But it takes time, patience, determination, and a cooperative baby as well. This is why, because of this, I would really encourage you to seek some support with this. So whether you stop breastfeeding due to medical reasons, separation from your baby, or possibly just bad advice, individuals do find that they can rebuild a milk supply successfully. Providing human milk for a newly adopted baby is also an opportunity for relactation. Or induced lactation. And sometimes relactation does produce enough breast milk to supply all of your baby's needs, and other times supplementation may still be needed. So how do we do this? So to start off, you can hand express or pump at least 8 to 12 times per day, usually for 20 minutes at a time, sometimes up to 30 minutes, and you need to do this at night as well. You can give this expressed or pumped milk to your baby in a cup ideally, or if they are currently using a bottle and not happy taking a cup, you can use that bottle, or you could use what's called an at the breast supplementer. And this is if your baby's, remember I said if your baby's being cooperative, so if they are happy to latch, you could use this. So this is a way of providing your breast milk via a small, very fine little tube taped alongside your nipple, which your baby will then get the milk from, a bag of milk that goes to the tube to your nipple, and as they latch, they get that milk as well. If your baby is latching, great, put them to your breast before and after each feed they're getting, or as I say, if you're using at the breast supplementer, they'll be latching then. If your baby's latching, offer them the breast for comfort between feeds as often as possible instead of using a dummy or a pacifier. And this will help. Any little bit of suckling at your breast will help build your milk supply. And as I said, it's a tough path, and so I highly suggest getting support from a lactation consultant or peer support group such as La Leche League. Just having that support, even just emotional and moral support, is great. Practically accept any offers for support with shopping or housework, because this can take a lot of your time. If you do decide to use herbs or medications to increase your supply, just be sure to contact a healthcare professional about this to discuss, ideally one who's supportive of lactation and breastfeeding, because you'll need to discuss your medical history with them as well as your breastfeeding goals. And then finally, just remember, breastfeeding, it's not just about the milk. Baby will get immune benefits from skin-to-skin contact, and from every drop of milk. Every drop of human milk is important. Okay, another great question here. So can breastfeeding act as a form of contraception? Yes, it can. Exclusive breastfeeding has been shown to be a very effective form of birth control, but there are certain criteria that must be met. Exclusive breastfeeding means just breastfeeding, so no supplements, no bottles, feeding at the breast. And if exclusive breastfeeding has been done, it's 98 to 99.5% effective in preventing pregnancy, as long as the following conditions are met. So your baby is less than 6 months old, your menstrual periods have not yet returned, and your baby is fed on cue or on demand, both day and night, and is getting nothing but breast milk or only token amounts of other food. But before 6 months, that's very unlikely anyway. Just in certain cultures, there are certain cultural foods that they might get token amounts of, and that would still be okay. So next question is, what is combination feeding? What does that mean, and how does it work? So combination feeding refers to combining breastfeeding and formula feeding. For some, this is a choice, and for others, it is because for whatever reason, their baby needs supplemental feeds. If it's the latter, it's worth contacting a lactation consultant or breastfeeding support organisation just to explore the reasons behind this need, and if you wish to work on increasing your own milk supply. It's worth also noting that the World Health Organization recommend donor milk, if possible, as being preferable to formula for supplementing your baby's feeds. So combination feeding, it looks different for each family depending on how many feeds are at the breast and how many are not. If feeding with a bottle though, it is very important that anyone who offers your baby a bottle uses a paced bottle feeding technique. So this is a really responsive way of bottle feeding a breastfed baby. Breastfed babies are very much in control of a feed, of how much they take. So paced bottle feeding respects that and also helps protect the breastfeeding relationship. So how do you do this? So you can offer your baby a bottle when their cues indicate their hunger rather than on a schedule. And if you hold your baby in a more upright position, and it's especially important to avoid them drinking a bottle when lying down. Such a position is associated with dental caries and also an increased frequency of ear infections. What we like to see is including a switch from side to side midway through the feed. This provides for equal eye stimulation, and it also, from a developmental perspective, their eyes will develop. They're not constantly looking at you from one side. And also helps prevent the development of a side preference, which could have an impact on the breastfeeding parent. So if your baby is always used to being bottle fed on this side, they may suddenly only want to feed from this breast. So we just want to try and avoid that. Feed should not be rushed. So give your baby's system the time to recognize satiety. I realize that they're full long before their stomach has a chance to get overfilled. When you are offering a bottle to your baby, you gently allow them to draw the teat into their mouth rather than, pushing it in. Your baby controls when the feed begins in this way. So you can stroke your baby's lips from, top to bottom with the teat to elicit a rooting reflex, similar to how you would when offering the breast. And you'll get this nice wide open mouth, and then you can allow your baby to draw the teat in and to accept it rather than just poking it in their mouth. Mimicking the breastfeeding rhythm as well is really helpful here. So have frequent pauses that mimics the pattern of letdowns at the breast. This will discourage your baby from guzzling the bottle and can also help prevent frustration with flow of milk when they are feeding at the breast. And you follow your baby's lead. Don't aim for them to finish every last drop of milk. If your baby is drowsing off and releasing the bottle teat before the bottle is empty, that means they're done. And so by doing this, you can avoid frustration at the breast. Your baby won't get fussy with the pace of the letdown versus a faster flow from a bottle. Your baby also won't overfeed, which is great, and it can also help reduce excess wind and those colic-like symptoms that a baby whose stomach is distended and has been overfed can experience. So next is, what are my best tips for engorgement? Yeah, this is a really good one if you're currently pregnant. Engorgement is the uncomfortable fullness that often occurs when your milk production increases around day 3 or 4. And so what we find works really well here is a combination of cold compresses and massage. And this is the key to relieving this uncomfortable fullness. So what you can do is apply olive oil to your breasts and then gently massage them. We're talking about fingertip massage all around the breast. You can gently sandwich and gently roll your breasts as well between your hands. But the pressure here, it's so gentle. It's like the pressure you use rubbing body lotion on. We're not digging into your breasts. Another thing to do is to use the palms of your hand in sweeping motions up the side of your breast towards your armpits. You have lymph nodes under your armpits, and some of the engorgement is not just from milk, it's from interstitial fluid building up, like breast edema. So if you had swollen ankles during pregnancy, very similar. We've got that fluid building up in the breasts. So by doing this lymphatic drainage, we can help relieve a lot of that engorgement. Cold compresses are also really soothing, and these can help reduce inflammation. And you should only really need to do this for the first day or two until the engorgement resolves. Try to avoid cold compresses just before feed or pump, as it can slow the milk down. And continue to breastfeed your baby at least 8 to 12 times in 24 hours. Avoid pumping or taking hot showers to relieve engorgement, because this can worsen the situation. If you are overly full, and even after massaging or after feed, just hand express off just enough so you're comfortable. One other thing that can happen with engorgement is your baby can struggle to latch if you've got this fluid buildup. So even if after doing the breast massage, the sweeping massage towards your armpits, even if your baby is still struggling to latch at that time, what you can do is a technique called reverse pressure softening. This helps if you've got fluid building up behind your areola and you find your areola is incredibly hard and your baby's struggling to latch because it's hard and not pliable. So you can try reverse pressure softening. This is a really simple manual technique. So what you do is you just get your fingers like this and you put them around your nipple, like a little flower around your nipple, and then you push back towards the chest wall and count to 60 seconds. Check it then. If it's soft enough, great. If not, hold for another 30 to 60 seconds. And just doing this helps physically move the fluid back away from the areola, softening it up and making it much easier for your baby to latch. So they are all the questions that I have today. And again, I would just want to say a couple of things. Like, for most breastfeeding concerns, there are breastfeeding solutions. It really is all about getting the right support. For more information, you can go to myexpertmidwife.com and check out their blog. And last thing I want to say is just remember, when it feels hard, it does get much better. It's a bit like hiking through the mountains. You don't realize quite how far you've come until you look back and see where you started. So take care, and thank you for joining me today. Hi, I'm Anna.